Lutheran Downtown Hospital will be located 1 block west of St. Joe Hospital.
WANE 15's Chris Darby continues our coverage of tonight's top story. Chris, what is the timetable for the project?
Behind the scenes work is happening now and will lead up to a summer groundbreaking next year. The building will be up and running in late 2021. St. Joe will come down, replaced by a parking lot about 6 months later.
We're proud of our heritage of being here since 1869, and we believe that this is the next chapter in serving the community and taking care of our patients.
More than a year after word of a new hospital downtown got out, we have the details. A $100 million building will replace parking lots connecting downtown to the West Central neighborhood.
I think with the Riverfront project and with Electric Works and all of the different initiatives that have happened downtown, that we're a cornerstone of that.
There will be a focus on outpatient care at Lutheran Downtown, but it will be an inpatient hospital with 60 beds and room to grow. An updated emergency department, operating rooms, cath labs among the features. The current MRI center will be leveled, that department moving into the new building as well. Also happening with the new building, the change of name, something that has been in the works for years.
All of this is being done by CHS itself. There's very little public money involved, but certainly a lot of public support.
Today's announcement is the latest move in the battle of healthcare providers here in the Summit City.
We are focusing on our strategy and executing our strategy, and it's those who can execute on that strategy that are going to do best.
A city our size having two competing systems is somewhat of a rarity, but we're really blessed to have that in Fort Wayne.
I did ask CEO Mike Poore about jobs. He tells me he expects many of the current St. Joe staff to stay downtown, with several more jobs possibly being added. In Studio 15, Chris Darby, WANE 15 News.
Chris, thanks. St. Joe Hospital's history dates back to the 19th century. The hospital first opened in 1869 in the former Rock Hill Hotel building. Over time it expanded, but in 1929 the original building was demolished to make way for a new 7-story structure there at Van Buren and Berry. A 9-story wing was then added on to the existing building along Broadway and Main, and more space at Van Buren and Berry in the 1960s. The Broadway and Main addition finished by 1980.
This has been a long road for St. Joseph Hospital and its parent company, Lutheran Health Network.
Last year, the organization's leaders announced that they were considering several downtown locations to build a new hospital. At the time, they hoped to break ground by this year. WANE
15's Angelica Robinson continues our team coverage tonight. Angelica?
Dirk and Tara, the last year has been full of ups and downs for Lutheran Health Network, particularly St. Joe Hospital. Plans have been in the works to build a new facility, but that's about all we knew. Today, the vision is a little bit clearer after months of speculation over the company's next steps. Last May, Lutheran Health announced a $500 million investment in its facilities. In September of that year, the company revealed plans to build a new downtown hospital. At the time, CEO Mike Poore said they had outgrown the building and the technology was outdated. He also told WANE 15 that they made an offer on a building about a half a mile away. Poore kept the potential site hush-hush, leaving many to wonder if the North River land across from Science Central could be a possibility. But a couple of months later, Lutheran Health Network confirmed that they were not considering that property. Rumblings about the location of the new hospital have been quiet in recent months, leading some to wonder if it will even happen. That's until today's announcement.
Many of us expected this facility to someday come down. And we were worried about access to health care for those who live and work downtown. CHS did not have to build. I think we all need to understand something, that this new hospital is something that didn't have to happen.